Good morning, good afternoon, and welcome everybody to today's seminar on local services available to seniors. My name is John Kendrick, and I'm the chair of the Endowment Committee here at First Parish Church of Stowe and Acton, which is sponsoring today's seminar. Before I begin, I want to just cover a couple of logistical items. Bathrooms are out the door and to the right. Emergency exits are also through the door you came in, through the back door here, and back through the kitchen. Today's seminar is the final seminar in a four-part series on topics of interest to seniors. Previous seminars in the series are available to view on Stowe TV. Estate planning and Medicare and Social Security I know are already up, and living options in the area I believe will be up soon. I'd like to thank the other members of the Endowment Committee here at FPC, Katie Weeks, Lori Prue, and Tom Moses, who helped to organize these sessions. And today, we're really fortunate to have two presenters from the Hudson Senior Center who will discuss local services available to seniors. Janice Long is the Senior Center Director, and Anna Salomeo is the Social Services Associate. Anna, you can correct my pronunciation of your name if needed. Okay. So they're going to discuss topics ranging from senior transportation, free senior transportation, to assistance with health care and health insurance issues, to field trips and other entertainment options. The services they describe, they can tell you more about, but are available in many area communities. And finally, before turning the microphone over to Janice, here's a brief message from the Endowment Committee of FPC Church, which is sponsoring the seminars. Our endowment is an important source of long-term support for FPC, and we encourage members and friends to consider making an estate gift to the endowment when reviewing or updating their wills or trusts or setting up beneficiary designations or other estate plans. So we greatly appreciate the members and friends who've already done that or who will do that in the future. And now we're looking forward to learning more about senior services, and here is Janice.
Thank you. So I'm Janice Long. I've been with the Hudson Senior Center for 18 years. And just a little history about the center that's kind of interesting. I find it very interesting. The Hudson Senior Center was renovated in 2010. Can you hear me? Oh.
Maybe a little closer to the mic.
Oh, sorry. I'm so sorry. Okay. Okay. And so the senior center is a small mansion, and the Hudson seniors purchased this building for $30,000. They collected their own money, and they purchased this building in 1978 so that they would always have a place to go. Prior to that, they would rent storefronts on Main Street, and they'd be fine there for a while, and then the owner would want to sell, and they'd have to go find another place. So at the time, the American Legion was at the Hudson Senior Center, was in this home, and they sold it to the seniors for $30,000, and it's unreal. And they all pooled their money. Then they turned it over to the town, and they promised the American Legion that they could always use that building for their meetings. And to this day, every quarter, they have quarterly meetings and they come to the senior center. So this senior center has real significance to the Hudson seniors because all the work that they did to, gather the money. Somebody wrote a grant and got $20,000, and then they got the other $10,000 and then turned it over to the town. So we did a renovation in 2010, about $5 million renovation, and it's just beautiful. So anyway, just a little history, because that's really significant, I think, because it really gives you an idea of what the community is like in Hudson, especially the senior community. Well, anyway, our goals is to effectively deal with the demands of our senior population. We feel it's really important to collaborate with other town departments and other agencies so that we can help meet the goals of our clients, because we have a great social service department, which you'll hear about in a couple of minutes. And in developing that sense of teamwork with other departments and other agencies, we've seen that an improvement in the client's overall quality of life. Not just the client, but, excuse me, also their families. Because a lot of times, the senior will come in and there's family issues that we're dealing with, spouses and children and grandchildren. So it's not just one person. It could be several. So that's part of our goals. In my opinion, I think that the social service department is the heart of the senior center, and I'll tell you why. Because prior to my going to Hudson, I worked at the Marlboro Senior Center, and I was there for about 8 years, and I was the outreach coordinator. When I first started there, it was a part-time job, 19 hours a week. About 1998, I was contacted by the SHINE program, Serving Health Insurance Needs for Everyone on Medicare. And they said that the SHINE program, it's a volunteer program. I know you had somebody from SHINE out, right? Great, I'm sure it was a great presentation. It's a volunteer program. A lot of people are retired. They take the training and they volunteer so many hours, in senior centers or wherever in the community to help people on Medicare. Back then, the SHINE program said, I wonder if we train outreach workers, the SHINE program will reach more seniors. And so at that time, I volunteered to do that. There wasn't a lot of outreach workers that did it, but I did. I took the training and I loved it because I was able to help so many people. Well, I guess we were doing a good job because more and more people were coming to the Marlboro Senior Center for SHINE issues, for Medicare issues. My job went from part-time to full-time, and before I left, they hired somebody part-time to help with the, additional clients coming in. So when I applied for the job in Hudson, I said, if I have to hire anyone to do outreach or social services, I'm going to have them trained in SHINE, because to me it was just part of the job. You're working with senior citizens, they're on Medicare, and there's always issues with Medicare. I mean, every year we have so many unusual cases and we all learn from each other, but I just thought, yeah, this is part of the job. We can do this. So I hired Anna. Anna was the first person I hired. Hudson has a large Portuguese population, and when I got there weren't that many Portuguese people coming to the center. So I hired Anna. She was part-time, and since then she's brought in over 200 people, Portuguese-speaking people, to our senior center. They come and see her all the time. It's wonderful. So anyway, that is why I feel the heart of the senior center is in the social service department, because you can bring in so many people. And then they look at the senior center, they see the different activities, and they get involved in other areas. So at our senior center, we have 3 SHINE counselors. And we have Anna, who is our bilingual social service advocate. And then we have Holly, who is she's our full-time. Anna works 30 hours a week. Holly works 37.5. And they both do SHINE, and I still do SHINE. Not as much as they do. I always help during open enrollment. I have clients that I've seen for a long time that I still continue to see, but they do an outstanding job, So just from experience, we know that having SHINE-trained staff at the senior center brings in a lot of people. And I'll just tell you, I think it was last fiscal year, our social service department saw over 1,100 people, unduplicated, individual people, over 5,000 times. That's a lot. That's just one department. So I'm going to turn it over to Anna to talk a little bit about our social service department, and then we'll talk about some of the fun things.
Okay. Hi, my name is Anna, and I'm, like Janice said, the bilingual social service advocate. I speak Portuguese, so I do help a lot of non-English speaking clients, but also anyone else that comes into the center. So, but as far as social services, we do a lot of case management. We do a lot of SHINE. As Janice already mentioned, half of our job is probably Medicare counseling. Services that are available through the outreach department is information referrals. So if someone needs assistance with home care, they need assistance with where should I live? You know, there's a lot of programs out there from options counseling through, you know, our ASAPs, which in this area I believe is Minuteman. There's a lot of services through your ASAP. Normally we'll refer for, you know, housing, options counseling. We also have most senior centers, and I know will have transportation options. So we have our own bus, and we go shopping twice a week. We take people to other errands, you know, like banking, medical appointments is a big one, obviously. Grooming, if you want to go get your hair cut, you know, people go and get their nails done, but we provide that service so when people cannot safely drive anymore, there's another option. And I know almost every senior center has that option available. We also do a lot with fuel assistance. So for our town, we're an intake site for fuel assistance. So if people need assistance with heating, we do that program. We do screen people for SNAP benefits, which were formerly called food stamps. So we do that. And we do a lot, you know, the case management of people. So Janice and I were kind of talking about that because someone might come in, they want help with fuel assistance, for example. Once you get to know them and talk to them, it kind of goes into other areas and you get to know someone. Maybe they came in for fuel assistance because they're really having a hard time financially, or they're having a hard time keeping up their home, and then that spans out to other areas. Maybe they're having, you know, an issue with someone in the family, and that's why they're having financial problems. So you can expand out to many areas once you get to know people, and you can help them with, you know, emotional well-being. Some of them are struggling emotionally, where you can make referrals to, you know, a social worker or someone else that they might need to talk to. Or they're losing some of their, you know, intellectual function, they're having memory issues, maybe they need help with money management because they can no longer write all of their bills out, but that, you know, there are a lot of programs out there that we can refer to and working collaboratively, like Janice said, with other agencies, and that's what, you know, a lot of the outreach does, is working on all the social well-being, financial well-being of people and the clients. You know, because many older adults, obviously they're facing losses. We all face losses, but as you get older, you're facing more losses, loss of loved ones, loss of your abilities, loss of some independence sometimes, which is very difficult. And having someone you can talk to is important. So, you know, Hudson, we're fortunate that we now have a licensed social worker, town social worker we can refer to as well when people need. We have some caregiver support groups. We have, Janice is going to talk a little bit more about our Daybreak program, which is a respite program for caregivers, for people that are having difficulty being home alone. So I'm going to let Janice talk a little bit about Daybreak.
I think when Anna was talking about the case management, I think it's really important to point out that it's very involved. You know, it's somebody can come into your office and you just kind of get a feeling sometimes. Sometimes they come out and they're forthright about what their needs really are. Other times it's not so. And like Anna was saying, you have to look at all these different areas, their emotional health, their cognitive abilities. I mean, is there some mild cognitive impairment there? What's going on in the family? Oftentimes they have to go out to the home, and they've got to do kind of an assessment of what that home looks like. Is it, clean? Is it cluttered? Is there a smell? Do they use some type of assisted device like a walker or a wheelchair? Are they able to maneuver those devices in and out of rooms safely? Excuse me. Can they get in and out of the house safely? So there's a lot of pieces to that puzzle, if you will, and it can take a long time to resolve some of those case management issues. I know last year we had 83. That's a significant number coming back from the pandemic, those case management issues. As Anna said, some can be resolved quickly, maybe within a couple of weeks, but we've also had cases that have lasted over a year and just needs a lot of constant support. And so our social service department, I can't say enough about them. They do an outstanding job on dealing with those very tough situations. So, I just wanted to kind of expand on that because it's not a quick thing. Those case management issues are not. And so time consuming, and you have to know what you're doing, and they do. So, all right, so I'm just getting to my, all right. So in addition to an outstanding social service department, some of the other programs that we have a wellness programs, and that consists of 17 wellness classes, which could be fitness, line dancing. We have 2 line dancing classes, 17 fitness classes, which are now being offered hybrid. So most of our fitness classes, you can have the option to come to the senior center, or you could do it at home. And this is something that I thought was very interesting. Once we came back from COVID, and we're all learning about Zoom and how to connect with people at home. Some people just don't want to come to the senior center yet. They're still very cautious, and that's okay. So how do we engage them and let them know we're here and we still have things to offer them? So we're trying it, and it does seem to work. But here's something interesting. One of our fitness classes is cardio and weights. It's offered twice a week. And we get about 7 to 10 people coming in for that class. But on Zoom, we have like 18 to 23. And so I said, oh my gosh, so it is making a difference. So people are, doing their cardio and weights at home, and they seem to like it. Here's another example. We also have a Parkinson's exercise class, which is just outstanding. It's outstanding. And it's offered in person, and it's also offered via Zoom. And so it's the opposite. So with our Parkinson's class, we get, and I know because I look at the numbers every month, I have to do a report, 5 to 7 on Zoom. We've gotten up to 30 people coming to our center on Thursdays for the in-person class. Now, why is that? I'm thinking it's because of the social connection that these people, they need that. They need that social connection and need to see their peers. They're all, and the instructor is just outstanding. He does an incredible job. He makes it fun. And they're sitting in chairs, and they talk, and they exercise, and they practice using their voice, because sometimes with Parkinson's, your voice can get weak, and so you can hear them yelling downstairs, So interesting that the Parkinson's class has a larger in-person presence than the cardio and weights. I just thought that was kind of interesting. So So we do have, I think our wellness classes are great. I don't know, Anna, did I give you do I have some samples? Oh, I have it right here. So I'm just going to give you a couple of examples. I'm not going to read everything, but we have mat Pilates, we have the cardio and weights. Let's see, we have Zoom chair Pilates. That's only offered in Zoom, and we have between 27 and 30 people just on that Zoom. That's chair Pilates. It's a Zoom chair Pilates. We have a stretch yoga chair that's only offered via Zoom. Same thing, huge, good numbers. Well, not huge, but 20 to mid 20 participants via Zoom on that. So, you know, we try to figure out what the people want. If they like it, we just, you know, we try to bring in new. If somebody has an idea of a different class, we look for it. We see if it works. And so far, the 17 fitness classes that we have seem to be working well. Recently, well, since COVID, we added 3, we call them healthy mind classes. So during COVID, during that period when we were all isolated, and seniors in particular were, you know, isolated, feeling lonely, we were all making phone calls, every senior center. I'm on the board for Mass Councils on Aging, and during that time, Mass Councils on Aging was so instrumental to all of us at senior centers, because we didn't know how to reach these people. We were all at home. Everybody was working from home. They were stuck at home. And what do? We made phone calls, hundreds and hundreds of phone calls. And what we found during that period was, in the beginning, it seemed fine, but as time went on, we could tell they weren't doing so well. We could hear maybe they were mildly depressed. They would talk about the loneliness, that you know, nobody's coming to see me, it's awful, I'm so lonely. And the big thing that we saw was anxiety, right, Anna? We could hear it in their voices, or they would just come out and say they were so anxious. So when it was time to come back to work and we opened up gradually, you probably remember towns were getting flooded with money. There was a lot of money going into communities, one of which was the ARPA funds. The ARPA funds, that's the American Rescue Plan Act. As soon as I heard about that, and I read about what you could use those funds for, I wrote up a little description to the town manager, and I asked for $16,000 so that we could have mental health classes to help our seniors as they come in to process what they've been through. We needed it as well. We all did, to process what we all went through. So our town manager, right, Tom Moses? Yes. Well, was it Tom or was it I'm not sure. It might have been Tom, but we have a new Tom too. Our town manager gave us $25,000 to do this. And so we didn't want to call it mental health classes because of the stigma associated for some people. Some of the older seniors don't like that term. And so what we did was we kind of masked it. And so we offered it's called a mindful living program. And that program is 4 weeks. It's a 4-week program. And people come and they learn how to relax their mind and try some meditation. And we're still offering it. It's very well received. People liked it. And they said that they're learning how to meditate. It doesn't come easy. I took the class myself. We took it 3 times. And I got to the point where I was actually in that state. And I just said, this is awesome. Another class we did was self-empowered living. And that was more talk therapy. And that was very well received. And then we have a stress reduction class. our stress reduction class we had prior to COVID, but after COVID, he got more participants, because as we said, we could tell everybody was kind of anxious, maybe slightly depressed, very lonely, very lonely. That was the big thing. So those were three additional classes we did after once we came back from the pandemic. We have a nurses clinic. We also have a social day program. I'm very proud of our outreach, our social service department. I'm equally proud of our Daybreak Social Day program. And I'll tell you how that came to be. Once we moved into our new building, we moved in 2010, and we started Daybreak in 2012. So it was less than 2 years, and we wanted to give back to the community for spending the $5 million for the renovation for our beautiful new senior center. So we thought, well, what we could do is maybe have a little social day program where people could bring their loved ones. We'd provide lunch, activities, and the caregivers could go off and just have some time to themselves. So this program has been funded. I've been lucky. I've been writing grants every year. It's been funded for 11 years via a grant. So we don't have to ask people to pay. We do ask for a $15 donation. Some people can pay that and some people can't. But it doesn't matter. We just, people can come into this program. So that was offered in Hudson, just in Hudson. We only did it one afternoon a week, and it seemed like it was working great. Well, in 2015, Bay Path Elder Services and attorney Arthur Bergeron, who's an elder law attorney, contacted me in Hudson, the Marlboro director and the Northborough director, and said, we're looking into this new program. It's called Minnesota Act on Alzheimer's. Do you want to get involved? And the Minnesota Act on Alzheimer's was a program that not just educated their communities, but it prepared their communities to support the people with dementia, various forms of dementia. Not just them, but also their caregiver. Because it impacts the community. We know it impacts the family. We know what that's like. But it also impacts the community. So all three of us, Hudson, Northborough, Marlboro, we said, yep, we're in. And we went to Minnesota for a couple of days, learned about the program, came back, and in 2015 we started it. It was a 2-year process. It took us 2 years to get to the point where we were officially called Dementia Friendly Community. And in that time frame, we had dementia training for our fire department, police department, library, senior center, town hall, banks, and we had community training for anybody who wanted to come in and learn how can you effectively deal with somebody with dementia. And no two people are going to be the same with dementia. It's always different. But great tips on how to deal with it. And so we did that. And also, there was a survey. Each community had to do surveys, and we had surveys for businesses, banks. Well, bank is the business, but we had businesses, the medical community, religious community. We gave them to restaurants, grooming facilities. We gave them out to everybody, and each survey was a little different. Once we were done with the surveys, once they were, the data, all the surveys were collected, I believe it, and I might be wrong, but I believe it was UMass Boston that took the data, analyzed the data, and then gave us the reports. And this is what was interesting. Now, every community is different, right? Every senior center is different. But the one thing that we all had in common was this. What we found was in the communities, people said, Yes, the senior center had information on Alzheimer's. We were great at giving out paper, right? We had it, but they said, we don't have any services. Now, we had a 1 day, half a day a week social day program, but we didn't market it apparently that well, because I couldn't believe they didn't know, but we obviously didn't market it well. And then with the 3 communities, Hudson, Marlborough, and Northborough, when we were looking at this data, and that was the one thing that we all had in common, I said, why don't we expand our Daybreak program to Northborough and Marlborough, and we'll take different days. So in 2017, that's what we did. We expanded our Daybreak program to Northborough and Marlborough. It's offered Tuesday, Wednesdays, and Thursdays. Caregivers, and they're close by, so people can go to all 3. And so now we have the 3 communities working together to provide that service, to give caregivers a break. And that's very important. But it's also important to have their loved one coming to the center and being engaged and seeing people and having lunch and participating in activities. So that has been great. So since 2017, Daybreak is now offered in 3 communities. Our friends in Sudbury have expressed an interest in also taking a day, which they're going to be opening up a brand new senior center soon, I think in December sometime. So maybe next year we'll be reconnecting with them, and if we can add another day, that's great. And again, we've been blessed that we've gotten grants that people don't have to pay. What is it, Anna? What is the going rate now for over 100?
Over $100 a day.
Yeah, depending on how many hours. It's very expensive.
Unless you can get a subsidy.
Right. Right. So that's just another thing that our social service department knows. So there are private pay social day programs. They are expensive, but they know about some programs that could help subsidize that cost. So, so we're very proud of our Daybreak program. Let me see, I wanted to share. So we just finished up a grant at the end of September. And we had, just so that you know, 43 people were enrolled in our social day programs. They didn't come all at the same time, because there are good days and bad days. Some people just went to Northborough or Marlborough or Hudson. Some people went to all 3. But we had a total of 43 people sign into that program. And with the last year, because I just finished the report, we provided 4,494 hours of respite care for their caregivers, which is huge. I remember when we first started Daybreak, there was a woman, she was bringing her husband, and one day I asked her, I said, what did you do with your 3.5 hours? Can I ask? And she looked at me and she said, I took a nap, because her husband had dementia and his clock was all mixed up, so she was up most of the night, so she had an opportunity just to catch a few winks. So, and the other part about Daybreak that I'll share with you is, as family members come and drop off their loved ones, they're connecting with other family members. And I've heard of them going out to lunch, meeting for lunch, and they're sharing some of these experiences that they're having and taking care of their loved one with dementia. That's critical, so that they don't feel that they're all alone. And they can see that other people are going through the same things. Well, what worked for you? So that was a great thing. So I think that our Daybreak program has been successful, and we're very proud of it, and we're happy to provide that service. Recreation and socialization, all senior centers have it. We've been, again, last year our numbers are coming up. They're still not what they were pre-COVID, but in last fiscal year, we had 900, just under 1,000 people attend almost 8,000 times for various activities that we have. Anna, you have that list? We can maybe share. We have community education. Every senior center has a variety of things, of programs. We have a pool room, bridge, grab-and-go lunches. That was a big thing. We're still doing it because people liked it. That's what we learned during COVID. It was people did like the grab-and-go lunches, and it was good for us too because that was a way when people weren't coming to the center, we could make contact. We could see what they're looking. We know what we hear when we talk to them on the phone, but when you see them, it could be totally different. So that was a good thing. You know, holiday gatherings, holiday luncheons. I mean, we just have a myriad of programs that we offer for recreation and socialization. Our transportation, like Anna said, we actually have 2 buses. We have 1 full-time bus driver and 1 part-time bus driver. The part-time bus driver, we get a little bit of money from the town, and then I get grant money to subsidize, because now that people are coming back to the senior center, we're seeing that 1 bus driver just isn't enough. So we offer food shopping 2 days a week. So our part-time bus driver does that on Tuesdays and Thursdays, and while he's there, when the full-time bus driver is really busy with doctor appointments, and we go from Hudson to Marlborough. That's all we do. We don't go out of Hudson or Marlborough. But if he's really got a lot of appointments in Marlborough and he's back and forth, our part-time bus driver on the days that he works will fill in and pick up people if he has to do that. So our transportation numbers are picking up. Like I said, last fiscal year we did see a decent increase, still not pre-COVID numbers, but it was 151 individual seniors took our bus, just under 5,000 trips. So you can see it is busy. Pre-COVID, it was over 200, so little by little we're getting there. Pardon me?
Fun stuff.
And then we also have our Friends organization. Our Friends, they provide volunteer, financial support to the senior center. They were instrumental in our building renovation. They actually put in a significant amount of money, just under $100,000 to help with that. So they usually buy our buses. So we have 2 buses. The Friends usually purchase the buses, and then they turn it over to the town. And then that's what we do. So areas of concern that we have, just to share that with you, is affordable housing for the elderly. Really not affordable. I'd rather say subsidized housing, because the affordable housing is just not affordable. a lot of seniors, especially when you lose a spouse and you're down in income, and so that's an issue. We see transportation will forever be an issue. It's just a conundrum. So that's still a concern. I mean. And then the other area is the financial security or insecurity of our aging population. According to, let's see, I think it was UMass Boston started this. As of 2022, 57% of adults age 65 and older who live alone in Massachusetts are unable to afford the cost of a no-frills lifestyle that pays for the basics such as food, housing, healthcare, and transportation. And that's always a concern. That's why it's so good to have a social service department that can address some of these issues. They know what programs are out there to help them with food, and heat. And so those are important things. And and also the stigma that's associated with mental health. You know, as I mentioned before, not so much the newer seniors. They kind of embrace the mental health concept, and they're fine with that. But I think older ones are just still, that terminology they're not comfortable with that. So we're still dealing with that issue. Do you have anything you want to add, Anna?
On that note, I just wanted to talk a little bit more to, Janice was going to talk about this, but about the fun side of the senior center too. Because most senior centers, there were a lot of trips pre-COVID. So there were affordable trips that people could go to. You'd be like local apple picking or just out to lunch, a local restaurant, to other day trips where you're going to Lake Pearl to see a show and have some lunch. And then there were cruises, multi-day trips. And most senior centers, if you're reaching out to your senior center, they're going to have trips. That all kind of stopped during the pandemic. Obviously, no one was going anywhere. So luckily, trips have come back, slowly. Like this last fiscal year, 267 people in our senior center went on 8 trips. And it's still, but people are slowly getting back to trips, which is, fun because you're socializing. I just went on a trip recently to Newport Playhouse, and that was a lot of fun. People had a great time. So I encourage you to obviously reach out to your senior center, see what other trips are going on, fun activities. We try to make them, affordable for people. We also have, obviously, even just at the senior center itself, we had a magic show a couple of weeks ago, and everybody loved that. We have music. You have bingo. Bingo is still very popular. There's cards. There's a whole bunch of social activities. So I think the social part really is coming back, and it's great because that's what was missing for all of us during the pandemic. We couldn't go out with our friends. Everybody was scared. I know people are still concerned, and everybody's fine to do what they're comfortable with, but I think people are really, really coming back to social, and there was a big need, and we saw that during the pandemic. Unfortunately, yes, we had to shut down to keep ourselves safe, but that did create issues with depression, loneliness for all ages, but especially, older adults, when everybody was like, you can't be careful, you can't be near your older adult because they're more at risk and stuff. So it was very isolating for all of us. So hopefully, that's coming back, which is wonderful. And during the pandemic, when we could come back up slowly, we did a lot of outdoor activities. A lot of senior centers did outdoor stuff, outdoor meals, outdoor grab and goes, as Janice said, they're still very popular. Concerts outside, all kinds of different things. The only other thing I really wanted to talk about was really get in touch with your senior center, especially this time of year. I know you had a Shine presentation a little while ago, but it's very important to review your Medicare during the open enrollment. That's October 15th through December 7th. And there are changes for 24. And even if you love your plan, it's wonderful, it's great, you should still just do a review because things have changed. So there's always changes in Medicare. And there's also ways that people, like we talked about the financial insecurity, there are the Medicare savings programs that people might qualify for. Some people could qualify for Medicaid, which is Mass Health. I mean, that has a very low income and asset test, but there's other, like the Medicare Savings Program, there's Prescription Advantage. I don't know if the Shine presentation, they must have touched on all these areas, but it's just call your local senior center. They'll connect you to your Shine person in your city or town, and it's really important to get that review. So that's what I wanted to at least leave you with for this time period. Do that review, even if you're 100% happy with what you have, okay? So I don't know if Janice wants to say anything else.
Questions?
Or questions.
This is the one, right? Yes.
Do you guys want to talk first? Okay. So I have 2 points or 2 questions. One of them is, you know, many of us have been here around long enough that I remember that it used to be like your doctor would take care of a lot of stuff like this. So what I'm wondering is, do you have you talked about all the stuff that you guys do. Do you have connections? Do you work with the medical community a lot? I mean, and I would imagine, given that they're so overstressed, that you probably get a lot more stuff than you used to have with them. So that's my first question. And I was wondering, how do you work with the medical community? So if my husband starts, and he's not, this is not the case, but if something starts happening with him, I could talk to my doctor. Do they refer us to you? What happens with that?
So we can both take turns on this one. So in the case management scenarios that we talked about earlier, most of the time, those situations, the person hasn't been to the doctor. Would you agree to that, Anna? Mm-hmm. And so it's kind of, figuring out what is going on. Do they have insurance? Do they know who their doctor is? And you would be surprised. Some people, when they have their insurance, they don't know who their doctor is. And so it's kind of like figuring out the missing pieces. And yes, the doctor's offices, they're wonderful. They do take care of a lot of things. They really do. We get involved when that type of situation, when there doesn't seem to be a doctor and we're trying to figure out what's going on.
There's also situations, we have a good relationship, I think, with a lot of the doctor's offices in our immediate area, and they'll, if they see someone that has, for example, expensive medication, they'll say, have you reached out to your senior center? Have you reached out to your Shine person to see if there's a way you can afford this medication? We've called doctor's office if we have a concern. They can't talk to us because of HIPAA, but we have said, we have this concern about this person. We see a decline in their health status or their mental health status or their cognitive status. So we just want to make them aware, because we know that doctors they do have a limited amount of time. We all know. We go to a doctor, you have maybe 10, 15 minutes. They don't always see the decline that we see, because we see people ongoing. And even during COVID, when people came back, I saw that a person had, people had more major decline than when we saw them 3 years ago, physically, mentally. So yeah, I think we also did some outreach in the past to doctors' offices where we told them, we do Shine counseling, we do, and we had a really good relationship with pharmacies too. And so it's building those relationships. And I think that a lot of senior centers do a good job building those relationships. I'm not sure if every single doctor's office obviously is aware of what's available at senior centers, but a lot of them are, and they do refer their patients, go see the Shine counselor in your senior center to help you with your insurance or this medication cost, or that they can maybe refer you to getting some home care services. Sometimes it's the other way around. We see people say, they need a visiting nurse to come in. Only the doctor can order that, or physical therapy at home, or whatever. So it's a give and take, and you need a good relationship. Try to build those relationships.
I just want to add to that too. Is we did talk about building the teamwork, the relationships with community agencies, and we have. The discharge planning departments from Marlboro Hospital, UMass, Emerson Hospital calling us, saying, look, we've got somebody in the community, can you help us with a list of issues? Can you help us with that? So I think we've been fairly successful getting out there, letting those partners know what we do, what we can do, and they're reaching out to us.
Social workers.
They've been, actually, somebody from Emerson Hospital came in my office last week and just praised our outreach department, our social service department, because of the work they were helping them with. So we can work together. And when we do, that's when I said that's when good things happen. You can see that the quality of life for the elder and their families, because families, it's a big part, you can see the improvement. And sometimes it's the loved one, it's the family. It's harder for the family to get across something to their loved one. We have to remember, you've got that, it's still the parent-child relationship. I know I took care of my mother for 3 years, and I could not, there were certain things that I couldn't talk to my mother about. I would have Anna and Holly go and visit her, and she'd say, "That's a great idea." So I really think that there's that, that dynamic. I mean, even in a healthy relationship, and I thought mine was very healthy, my mother-daughter relationship, but at that point in her life, it was easier for her to hear things from somebody outside the family.
I have a completely separate question. John and I both go to this voice teacher, and this voice teacher, and your talk about the Parkinson's exercise program made me think of this. This voice teacher does a session, I think it's once a week or something like that, with people with Parkinson's. And singing is one of the very few things that people with Parkinson's can still do. So I just wanted to make that suggestion as something, and I think that a lot of people who are trained in this particular method, which is really good for the older voice, it's called the McCloskey method. Mm-hmm. A lot of those teachers are going to be really good at something like this. So I just thought I would make that suggestion.
Thank you.
And I think also too, with in that point too, with Alzheimer's and dementia, music is one of the last things to go. So people love music. That's very important. People come alive with music.
The question. You mentioned the Zoom classes and so forth. What is the fee arrangement, if any? If you live in Hudson, do you attend these classes for free? Let's say you live in Acton or in Stowe. Can you attend online? Is there a charge depending on where you live or not?
So, yes, we do charge. If somebody can't afford it, they just need to talk to me, and we waive that. But we charge $10 for the month for most of our classes. If you take 3 classes, we offer stretch break for free. So, Parkinson's is free. Parkinson's and stress reduction is free. So some classes are free, but some have a $10 a month charge, yeah.
So would someone then, if they wanted to take your Pilates, my wife loves Pilates, from Acton, she would call the center, get the sign-on information, pay maybe over the phone, or send a check in or something?
Send a check in. We don't do the credit card thing yet, but we do take people from other communities, and she would just have to call up and sign up with Virginia at the front desk, and Virginia will send the information to the instructor, and then she'll send her the Zoom link if that's what she wants to do. Either does she want to do it by Zoom, you think? Or
yeah, she does it right now. Yeah. One other quick question, which is now slipping my mind. Speaking of dementia and early illness. Anyway. So I'm going to pass it along to whomever else has a question. Are we all good?
I was going to say too, call your local senior center, wherever community you live in, because we all have a variety of different classes, different community education, but we all have wonderful things to offer. So if you haven't gone to your senior center, I would encourage you to go visit, go check it out. Look at they all send out newsletters. Look at what's going on. Because there's a variety of things that you'd be amazed what people are doing at their senior center. So if you haven't gone, go check out your local senior center.
The question has come back. Medicare review, you suggested doing it every year. Just on your own, or do you actually encourage people to come in and do it with a Shine counselor?
We can even do it over the phone. So, I mean, if it's complicated, it's probably better to come in. But I tell people, if it's just, we're checking just your standalone drug plan, I can do that. We can do that over the phone. And it's just to make sure, because every year plans change, and sometimes your tier 1 drug could be changing to a tier 2 or a tier 3. And you don't know until you well, unless you open your mail, but a lot of people don't open their mail, and then they don't go to Shine, and come January, they say, oh, I can't afford this, and then we got a problem. So we encourage people to at least call.
You can do it on your own. Obviously, there's the Medicare.gov website, and that's what we use for Shine. But a lot of people don't go into the nitty-gritty details. A lot of people will just look at, oh, what's the cheapest thing I can get, but they're not looking at the actual details. So it isn't that you can't do it on your own, but it's better if you go to a Shine counselor, because you can get free, unbiased, looking at because if you just go to it's better than going just on your own, because there's a lot of little hidden details in there. So we'll just give you all the information, and you make your choice. You make your own choice of what you want.
Janice and Anna, we want to thank you. This was terrific. Really enjoyed it. I hope that all the members of FPC who couldn't be here today, because there were several social action items going on, will watch on Stowe TV. Thank you to Jonathan Daisy back here for recording all 4 sessions. And please feel free to watch them all online, because they all were very valuable. So again, Janice, Anna, thank you very much.
Thank you. Thank you.